I'm Emma Dalton. I'm a nurse living in Melbourne. I also have been involved in OHS for a few years now and spent a good part of, or most of last year, working in the Respiratory Protection Program at the hospital. So fit testing healthcare workers with N95 respirators, and got a lot of experience and understanding of how respiratory protection works and masks and standards and all of that. And nowadays I'm now working in the health and safety department, and yeah, I think it sort of brings a slightly different perspective to some of the challenges posed in this pandemic to one that is a purely clinical or infection control based perspective. There's a wider range of tools in the OHS toolbox, and yeah, I'm pleased to have the opportunity to share some of that with you. Masks in schools, so preventing school spread and protecting the community. And we are going to just go over how COVID-19 is transmitted, how COVID-19 can spread indoors, how COVID transmission relates to schools, what protection we can get from masks, and how to achieve the best fit. So how does it spread? Long story short, through the air. There's been a lot of conversation about this over the last couple of years, and we talk about aerosols and droplets and talk about what size that is, and at the end of the day it does transmit through the air in one form or another, and we know that there is a spectrum of particle sizes that we produce normally as breathing beings, and they range in size from larger droplets that you can see to these very, very small particles that we can't see. So as I said, breathing alone creates aerosols. You don't have to be doing anything fancy or special or a particular procedure. We are emitting aerosols all the time. However, if you are breathing more heavily, you will produce more aerosols, as well as speaking more loudly. Things like that, yelling, singing, also produces more aerosols. Now, one of the other things that's important to note with COVID-19 is 20 to 45% of people, and this is pre-vaccine, exhibited no symptoms throughout the course of their infection. So that's important in that we can recognise that you don't need to feel unwell to potentially be infectious. So it does make it a bit more challenging when people are trying to do the right thing. I won't go out if I'm unwell. That's great. However, what we know is that we can be infectious before we realise. Infectiousness also peaks before symptoms. So the peak period of infectiousness, and this is once again pre-vaccines because it does change things a little bit, but 2 days before symptom onset to a day after symptom onset is the peak time of infectiousness. So what this says is, we need to take a precautionary approach because by the time you realize you've passed those sort of critical points in time. The infectious particles travel far from the individual, so we know that they will travel more than 1 meter, 1.5 meters, 2 meters, whatever the distance is that's been given. They will travel further than that. So the infected person breathes out these particles of varying sizes, and the other person inhales them. And the larger particles will stop further up the airways, and the smallest particles will go deeper into the lungs. And we recognise as well that you know, that can be more hazardous. The smaller particles getting deeper into the lungs, they've bypassed a lot of our protections, our own protections in our body along the way. Now, the other question is, well, you know, how long do these particles stay in the air? This graph shows the distance, the distance and the time that particles of different sizes spend suspended in the air. So the largest particles, which are the 100 microns, drop within 5 seconds. So they hit the ground in 5 seconds from 1.5 meters. So if someone's standing up in the, you know, height of someone's mouth. 5 microns, which and 1 micron, so 5 microns, 33 minutes they are in the air for, and 1 micron, 12.2 hours. Now, if we go back to this slide, we see that we produce, you know, the aerosols that are exhaled can be smaller than 5 microns. So we are producing particles of this entire spectrum, and this is where our risk is. They linger in the air. You can leave the room, someone can come in after you, and they're potentially still breathing in particles that you've left behind. There's a video here which I hope will play. I'll try. I want to show, it's a simulation of how someone's exhaled breath will spread in a classroom-like setting. So this is modelled with some open windows here alongside the, you can see these are open windows. So we've got someone here who's infectious. This is the time. So they're just breathing normally, and there are a few coughs, like 3 coughs along the way. This is a simulation showing where their exhaled breath spreads in a classroom or, you know, a room, and this is with some open windows. So what we see is, you know, within 1.5 minutes, the particles have reached it pretty much every corner of the room. And if this person is infectious, that's infectious air that is floating around the entire room. So that's just in, you know, 1.5 minutes. So you're there for, you know, an hour, 2 hours, 3 hours. That just keeps accumulating. So one way to think about aerosols, in a way that we can recognise, is to think about aerosol spread like cigarette smoke. Now, the particle size in cigarette smoke is similar to a lot of respiratory aerosols, and that means that it behaves in and it comes out of your lungs. It behaves in a similar way to, you know, what is potentially infectious in terms of the way it flows through air and the way it dilutes. obviously overspace it, you know, as it moves out into a room or fills the space, it's less concentrated, it gets diluted. So I wanted to have a think about that. So, you know, if someone's smoking, how far away from them can you smell their smoke? Now, 1 meter, yeah. 2 meters, yeah, depending on which way the air's blowing. 3 meters. And what if someone's smoking indoors and you're in the same room as them? Is it going to be, you know, could you be at the other end of a room and be able to smell their smoke? Probably. If someone was smoking in the room, you came in after they'd left, could you still smell the smoke? Could you smell the smoke maybe from the next room where, you know, maybe it's gone under the doors or through vents? Now, if you can smell someone's cigarette smoke, you are smelling air that has been in their lungs because they have inhaled that smoke, it's gone into their lungs, they exhaled it, and it's reached you. So that's a really good model to think about how in the real world we experience aerosols spreading in various spaces. And another thing to think about is on a really cold day, how our breaths, you know, you can see the vapor of your breath, you know, you see it spreads quite far. And that's another thing to think about. Well, that is air that's been in someone's lungs. So are schools safe? Now, in Victoria, we went through a Delta wave that just, you know, kept going and didn't get much better. And education sector was overall the biggest source of cases. So this is a plot. This was active cases at the 5th of December. So, you know, towards the end of the term. And you can just see how many cases were linked to education. And this has been mirrored around the world. It's a no-brainer that when you've got a lot of people gathering, that's going to be an opportunity for infection to spread. I mean, there's no end to people, you know, pre-COVID talking about how they've got a cold, their kid came home from school, they're like petri dishes. You know, we know that colds and coughs and other infections spread in schools. This is no different. And, you know, we've got clear evidence of that. And given, you know, how, you know, you're bringing people together from different households, that increases the opportunity that there's a affected household. And the other side to it is it means that a whole bunch of households are affected if there's you know, transmission in a single classroom. So that's quite telling. I think there's no debate, and I think for a lot of people now it's a bit of a no-brainer that it's a risk. Now, what can we do? Now, we obviously don't have control over the environment, and you know, there are improvements being made. Is there more we can do? Absolutely. So we can do respiratory protection. Some key points are to wear the best mask you can get. Mask at all times in shared indoor spaces. Remove your mask only when outdoors and distanced. So what that means is you put it on before you go inside or as you're approaching. And, you know, if you need to eat or drink, you go outside. This is best, you know, best practice, I suppose you would say. I know that some people, you know, may, you know, not be able to do that at all times, but this is what we aim for. Masks are safe and effective. We've got so much evidence now how effective masks are. Even our good old cloth masks, which are now being upgraded, they are still effective in many ways. We just know that we can do a lot better, and the game has changed. Things, you know, we need to up the ante now because we're now facing more infectious variants. Now, masks can take a bit of practice to get right or to get comfortable, and certainly a period of adjustment. You know, I've seen this in healthcare workers as well. A lot of people are like, this is uncomfortable, I can't breathe, you know, and a couple of weeks later, they're feeling a lot better about it. I think it's probably something deeply ingrained in us that having something covering your mouth and nose is an alarming sensation, and you know, it's a bit of, I guess, training your mind to recognize that in this case it's okay and you can still breathe and it's you know, safe. So I think there's certainly a bit of adjustment with that too, bit of brain training. Now, why is the fit of a mask so important? Got, you know, flappy sides, air will very readily entrain around the sides, and then, you know, the air that you are inhaling isn't filtered. That means that you are breathing in contaminated air potentially. And the other thing is that really good fitting masks, of course, stop the leakage of infectious particles from someone who might unknowingly be sick. So that's one of the brilliant things. The better the fit of the mask, the better it is at protecting you and others. I want to show you this video, which just shows they've used fluorescent aerosols basically to show a couple of different styles. So there's the surgical mask, and then what is a KN95, which isn't quite as good as our N90, our P2s or N95s because of the ear loops. But oh, sorry. So this is a surgical mask. You can just see all the leakage. If you're standing behind someone, the surgical mask are potentially coughing all of their breath. So this is a better fitting mask and there's a lot less leakage. Still a bit, but a lot less. How do we achieve a good fit? So we need to take steps to achieve a good seal. So we're talking about a really good seal of the mask to our face, to our skin. We want to start with clean, dry skin. creams, moisturizers, things like that can impact how well a mask sits on the skin. We want to mold the nose wire well and no pinching. So it needs 2 hands, not one. And I'll show you how to do that. We perform a user seal check. Now, a user seal check is basically forcing air in or out and detecting if we can feel any air blowing out around the seal. So it's a good way to identify leaks. Unfortunately, it's obviously not sensitive enough to ensure that there are no leaks, but you can detect some bigger ones. So do it. Just bear in mind that there may still be a leak. For people with facial hair, removing facial hair, and practicing putting on your mask or respirator at home, and getting a really good fit, so that when you're in that situation, when you need to get it on and off, that it doesn't take too much thought, and that you don't need to rush it because you're a bit more used to it. So I wanted to show you, so this is a typical kind of surgical mask. What we're with these, pretty simple, straightforward. You're putting it over your ears, unfolding it and molding that. Now you can see, like, this is just really floppy. That's going to provide limited protection there. If we are looking at N95s or P2s, I've got a few examples here. These are P2 N95s. These are designed to seal to your face. And this is another one which you may have seen, this kind of style around. These I got at, this is from Officeworks, and you'll see that this actually comes with this hook as well at the back. So this is another style that you've probably seen at Bunnings. These are all the same thing when we're talking about particulate respirators, P2s, 95s. They're different names for basically the same standards depending on the country. So P2 is the Australian standard, and 95 is the US name, the standard. So, okay, how do we put this on? Now, if it's come folded in half, we want to unfold it and we want to flatten out that wire because our noses aren't that pointy on top. That's the first step. This one, check that we've got a good seal. And you can see that when I'm breathing in and out that this is collapsing and opening up. That's a good start. Now, otherwise, we cover the mask or the respirator. The reason we do that is we want to block the air from going through the material, because that will then force air through any weak points in the seal. But we're not pushing on our face, we're just holding over. So, and breathing in, short, sharp breath,
And then if we can feel air blowing out anywhere, that indicates a leak. So then if it's a, common area of leakage is down here, and the tear troughs. So it might just mean that you just need to mold a bit more either side.
If anyone's having trouble seeing Emma too, if you change your view to speaker view, you're not hearing you. Your microphone is great, but just to see you larger, if you change your own view to, like, not your view, Emma, anyone else, change the view to speaker view just to see Emma better.
Okay, so if you're getting leaks around here or here, it's too big for you. Now, if your respirator or mask doesn't come with a hook at the back or doesn't come with head straps, you can get the ear savers, and I believe Jill's got some of those. It might look something like this. You may have some variation of that. It's a simple bit of plastic. Other people have used all sorts of things. And, in the case of, let's say, this surgical mask, if I wanted to improve its fit, because as we can see, it's very floppy, we use that at the back. It's no longer sitting around the ears. This is still, for me, too loose, but you can achieve a better fit that way. Now, that's how most of them work. This one, sometimes you need to give it a bit of a stretch. Cupping it in our hands there, onto our face. Top strap sits at the crown of the head. That's sort of like the peakiest bit of your scalp. And then the bottom strap is at the base of your skull there. It's really important to have these straps positioned in that area. It means there's no pressure put on your ears. And that's, holds it better to your face. Same thing here is just molding to the nose, doing your user seal check. These are very reliable in terms of fit for a lot of people, and they do come in different sizes. So for larger kids, you'll be able to get a small size in a cup style that will fit your kids. I wanted to also cover a few other ways. Oh, here we go. So I've talked about sizing, so finding the right size. There are more options around for smaller people and kids nowadays. Now, remember, typically respirators were used in industries that predominantly men work in. So even for women and healthcare, this was quite a struggle. There weren't many options for women who had just had smaller faces or features. There are more available now. Finding a mask with a nose wire is really important as well. There's the knot and tuck technique, which you may have seen. So that is in a surgical mask to improve its fit, is knotting right at the mask end of the ear loops. And then you end up with this kind of thing. And then you tuck those pleats underneath the knot you've created. And then you put it on like that. and mold your nose as well, and make sure your chin's nice and tucked in. So ideally you've got that nicely tucked under there, and you can see that, you know, that's already fitting a lot better. I wouldn't say it's sealed to my face, and but it's certainly, you know, many times better than how it started. We've talked about ear savers, head straps, if you can find models with head straps. This is an example of a surgical mask. This is what surgical masks typically are like, were like in healthcare, at least pre-COVID. They were all head ties. So, you know, right at the beginning, 2 years ago, this is what we were using before we ended up with this kind of thing. So this is great as well, because you can actually achieve, not only do you have head straps, but you can achieve a much better fit. And this is also kind of got a nice little duckbill there. But I mean, that's really actually quite well sealed when you put it like that. And typically the material of these masks themselves, yes, an N95P2 may have a higher grade of filter material, but most of the time there's not a huge difference between the material, but the big difference is they're designed to seal to your face, and they do provide a seal, so there's less air leaking through the material. We also have various designs now for mask braces or fitters or fixers, which are designed to, you know, sit over your loose surgical mask and to improve its fit and hopefully create a seal.
So this is going to be. Oh, sorry. Oh, it's just me with a weird echo. I think this is going to be really cool, because at the moment, at least in Newcastle, you just can't get kid-sized. Maybe you can. I can't find any kid-sized or small KN95s or P2s at all. So I think the best short-term solution is a mask brace, because yeah, we just can't get them.
Yeah, and there's definitely going to be a level of making do, and that's one way that we can do it. There's a few different techniques around. We're going to do a little DIY after this of making some mask braces. But yeah, there definitely there are more options around in the world. They're not really locally available as such, but I think they will become more available. And, you know, the bee's knees is a P2 and 95. That's, you know, the right size. So that's what we will be aiming for ultimately. And they can be reused. They're typically a lot easier to manage because, you know, they're designed to fit that way. So you put them on and they stay on your face. They don't move around. I actually find an N95 far more comfortable than a surgical mask, especially these awful ones. So let's look at, good, it hasn't loaded again. This is an example of a mask brace, and you may be able to see in this picture the sort of aerosol leaking before and after applying the mask brace. And then we've got a little DIY video. So if people have handy some elastic bands and a surgical mask, we can do this. I need to.
And then the other thing that Emma sent to me is a like template and instructions for how to make these kind of fancy ones. You can cut them out of a rubber sheet. So if anyone's interested, oh, you've done it.
I made one today as well. I might show you that now as well. This I made out of a broken fitness band, a physio band. So you download the template and cut that out, and really my cutting skills clearly didn't progress past primary school, but this is the template that you trace around onto your rubber, and that's what I did, and I cut that out. Unfortunately, I did also break it, but you know, that's seen better days anyway, the that particular band. So I'll show you that in action. So let's just say I've got this on. Surgical mask. And then this. And this would probably take a little bit of practice. Now this then goes around here. So right, and ideally sit this lower down on the cheeks. That forms a bit more of a seal, and that sits around the head, so it keeps it in place, stops it moving. I've just pulled that out of place. There we go. And improves the seal, particularly along here. It's not perfect. I think for me, I've got a prominent enough nose bridge, which actually makes the fit of P2s better for me anyway. But this will certainly serve people who have, and probably kids who have less defined features. You know, they haven't fully grown yet, or people who have flatter features. This will help seal very well along here. So that's one example. Now we'll watch a little video, and if people have some elastic bands heavy, you can join in on how to make a quick DIY version if you don't have broken fitness bands lying around. So I will just, let's play that. Oh, okay, that just skipped right past it. There we go. Try again. Thinking about it. So you want a surgical mask and 3 elastic bands. We'll let the computer think about it. Yes.
All you need is 1 surgical mask and 3 rubber bands. Step 1.
Okay, 3
create a
rubber
band
bands.
chain. Loop 2 of the rubber bands together, like so. Repeat with the remaining rubber band.
So yeah, basically you're creating a chain of 3 elastic bands.
Step 2. Apply your surgical
Pop
mask.
the mask on.
Stretch the mask over your nose and chin and minimize the number of pleats. Step 3. Stretch the central rubber band over your nose and mouth.
You put your
and secure the side rubber bands behind
over
your ears.
your snout, I suppose you could say.
Mine's pretty small, I reckon. I need a bigger one.
Yeah, I had a bit of a plague. Not all rubber bands are equal. That's one thing I will say.
Need some extensions. I've got the broccoli rubber bands. They're clearly
Step
they're
4.
quite
Adjust
tight,
the fit of
aren't
the
they?
central rubber band so that the rubber bands
you
inside
can
of the
see,
surgical mask
so
at all
she's
times.
making sure that the
Now we can perform a quick seal
elastic
check
is
as guided by the
fitting
CDC.
on mask at all times.
Place both
So
hands
that'll
completely over the
improve the
respirator
fit. So you don't
and
want
exhale.
the elastic
If you feel leakage,
the
there's
ring
not a proper seal.
landing outside of the mask. And she's just doing a user seal check.
If air leaks around the nose, readjust the nose
now,
piece.
This
If
particular
air leaks
model
around the
has
mask edges,
her
readjust
facial
the position of the
structures
rubber
a
band.
bit more suited, I think, to this design. It won't suit every face. Fail. And it might take a bit of a play of different elastic bands. I had, some better results with some But at the end of the day, they are definitely improving the fit. Are we getting a complete seal? Not all the time, but it's certainly better than it is without any at all. So that floppy surgical mask.
Even
So,
his surgical mask fitting better was I used a rubber band just at the back of his ear straps, because for him to try and then put an extra ear saver in when he was doing it himself was really hard. So at least when he had the elastic band version of that, he just could put that over his head. And then I don't think putting a mask brace on over that should be fine. But him fiddling around to try and use an ear saver, I just feel like that's less practical. But the elastic band version at least pulled it pretty taut, and
makes it a bit easier too. You know, getting it on and off. I think, the other thing that some people might do is just shortening the ear loops. So, you know, just shortening those ear loops, even if you haven't done this, you know, tucking procedure, that'll sit, you know, closer to the face. The trouble is, of course, with ear loops, 4 ears can only take so much. So, you know, that can start getting a bit uncomfortable depending on how tight it is. The other option is you may wish to, if your kids have some, you know, well-fitting cloth masks, is wearing the surgical mask and then the cloth mask over the top. You know, coming into, like in summer, you know, it obviously will make it a bit hotter, but you know, that is still an option. And yeah, I think that is probably, the bulk of what I wanted to cover, and I'm here to answer any questions you may have.
Hi, Emma. Phoebe here. I was just wondering, you mentioned very briefly earlier about reusability, about being able to wear them multiple times.
Yep.
You can talk a little bit about which masks that's okay with, and for how many uses we might be able to get away with that when they start to become not fit for purpose anymore.
Absolutely. So the manufacturers typically don't have a limit to how long you can use them for. So I'm even talking about P2s. There is no limit. Typically, the advice is once you remove it, it goes in the bin now. But that comes from a time, well, you know, from a setting where you might have asbestos all over, or, you know, a silica or whatever hazardous dust on the outside, which can come off. You just want to, and you want to remove it and throw it out. And that's in a, you know, workplace, which demands higher standards than personal use. Personally, I reuse reuse my P2s until they stop sealing properly to my face, a strap breaks, or over time they get fluffy because I've, you know, put them on and, you know, I adjusted that and the fluff annoys me. So you can keep using them. I would probably say, I mean, especially if I'm out and I'm rushing around getting hot and sweaty, you know, I would, you know, at least get a week out of one. I'm not wearing this, not necessarily 8 hours a day, but, you know, times when I've been in the office wearing them for 8 hours a day, I would still get 3 days out of them.
So do you do the same mask for 3 days? I've seen other people cycling through them, like wear it one day and then leave it in this, you know, and do it. Yeah. But like what? So
I take it off and I hang it on a hook or on my door handle. I live alone, so there's no confusion about whose mask it is. You know, you can pop it in a paper bag or hang it outside if you want. Given what we know now, that this is predominantly airborne. We know that the way the materials and these filters function is the particles get trapped either by static charge or just between the fibers themselves. They don't re-aerosolize, they don't go back into the air. We also know that despite some of the messaging that's still coming out that's quite attached to it, I can touch this all day and touch my face. I really need to breathe it in. And it also needs to be small enough and needs to be enough of it. So that is the least of our worries, that aspect of it. But it's a very good question. And for, you know, for a period of time there, I wasn't reusing them because I didn't know any better. And we certainly can. The few pointers are you don't want them getting wet, or if they are moist, they do lose some of that electrostatic effect. You know, if they're getting gunky or whatever, that could also affect some of the ways the particles are trapped. But once again, they're still going to function better than a loose mask. And yeah, so keep using them till they fail.
Yep, got it.
Yep. And the other point, sorry, is that in some areas or in some applications, if you're, say, doing plaster work, the filter itself is going to get blocked up. That's one of the end points, is when it's hard to breathe. That's not happening in the case of we're not working in dusty environments. So yeah, it's really great, actually. We can get a lot of use out of them.
Good stuff. Thank you.
Oh, you've got it. What have you got there? Is that a 3M?
This is these are actually some that we had in the cupboard just for the purposes that you explained. I've got my husband's, we were doing some renovations, so we've got a bunch of these.
Perfect.
They are kids, unfortunately. My 9-year-old tried one on. This is my 7-year-old. But 9-year-old, yeah, she found it difficult to breathe in, but we feel, as you said, with a bit of practice and maybe you know, short spurts, you might get more comfortable with that. Right. And I mean, yeah, certainly, yes, we were talking earlier about projecting voices and things like that. I mean, yeah, I think this, yeah, it's definitely better to have something that's really going to have a good seal and good coverage that way. So,
and just in a nutshell, surgical masks were designed. Their purpose is, you know, to stop splashes, large splashes of fluids or whatever it might be, or to stop contaminating a surgical field. They're not designed or really, and their standards are not set to prevent respiratory infection. They're just not fit for purpose, unfortunately. Better than nothing, but we can do better. We know better as well. So
masks that we had going around last year had a pretty decent fit. So over the top of the surgical mask is going to be better than nothing. Like if the elastic's not working, you need something.
I like that.
Like a couple of Jimmys are hopeless, but a couple of them do push the surgical mask on better. And been comfortably wearing the 2 masks at the park and stuff. I feel like, it's something like we all can do, because there's so much we just can't control. And
no, it is really empowering, actually. I've really enjoyed the session tonight. Thanks so much, Emma. And Jill.
I'm glad to hear that.
It's been great. Really practical tips and stuff that, I've learned a lot. So, yeah, it's been really good.
Oh, thank you for that.
Thanks so much.
We'll spread the word. We'll get it out there. I think, you know, knowledge is power, and I know a lot of people, they want to be safe, they want to protect themselves, their kids, you know, people want to get on with the things that we have to